The good news is that it goes away in most women by their fourth month of pregnancy. But about 1 to 2 in 10 women are unfortunate enough to feel sick for their whole pregnancy. The other bad news is that it tends to happen again in the next pregnancy if you had it in your first one. Hello, welcome back to Gyno Info. Or if this is your first time, just welcome. I'm so glad you discovered us. In this podcast, we discuss common gynecological problems in a frank and open way that normal, everyday women can understand without a medical dictionary. Today, we're going to talk about something that happens to many of us, morning sickness, or NVP, nausea and vomiting in pregnancy in doctor speak. We'll talk about what may be causing it, what you can do about it, and how much may be uncomfortable but still counts as normal, and when morning sickness becomes dangerous for both you and your baby. Even though this nauseousness in pregnancy is called morning sickness, for many women it is really more like an all-day sickness, feeling at least queasy, but many times much more than that, all day long. For me, it was mostly exhaustion sickness. The more exhausted I was with my pregnancy during my medical training, the more nauseous I felt. Curiously enough, I never felt sick while I was doing surgery. But as soon as I was finished operating, I'd race to the restroom and throw up, barely managing to rip off my surgical mask in time. First, just how common is this uncomfortable symptom of early pregnancy? Between about half of all women to almost 4 in 5 women suffer from it. It generally starts about a month after you got pregnant, though many women swear they felt morning sickness the moment they got pregnant. The good news is that it goes away in most women by their fourth month of pregnancy. But about 1 to 2 in 10 women are unfortunate enough to feel sick for their whole pregnancy. The other bad news is that it tends to happen again in the next pregnancy if you had it in your first one. Now let's talk about what causes morning sickness, the term I will be using for the rest of this podcast. Nobody really knows for sure what causes it. The best guess is that there are many things that can play a role in causing it, that it's not caused by any one factor, but by several different ones in different women. We do know that it's somehow related to the size of the placenta. The larger the placenta, the more likely a woman will feel sick to her stomach. For instance, if a woman is pregnant with twins and has a larger than usual placenta because the placenta has to feed 2 babies. Another reason for the placenta to be unusually large is a so-called molar pregnancy. Then only the placenta part of the pregnancy grows and the embryo part, the baby part, disappears. So those women with a larger placenta will feel more morning sickness. Newer research shows that a certain type of growth hormone, plus the hormone called human chorion gonadotropin, HCG, which is used in pregnancy tests, play a major role in morning sickness. Both these hormones are produced in the placenta, and so it makes sense that a bigger placenta makes more of these two hormones, and women who have a bigger placenta will have more nauseousness. But there are also certain inherited genetic factors that can influence whether a woman is more or less prone to experiencing morning sickness, which also explains why the women in some families are more likely to throw up in pregnancy than in other families. And some women just tend to feel sick whenever they are stressed and tired. And if there's one thing that makes you tired and stressed, then that is pregnancy, for sure. Next, I'm going to tell you a few things you can do that may make you feel a little bit better and will definitely not hurt you or your baby. But that doesn't mean that you do not have to go and see a healthcare provider for regular prenatal checkups. Women without prenatal care are 3 times as likely to give birth to a baby that is too small, either because it did not grow well or because it was born too early, or both. The risk of complications for the mother, including death, are much higher without prenatal care, which can pick up problem pregnancy before they turn into disaster pregnancies. The most important factor for a baby to be born healthy is, and always has been, and probably always will be, a healthy mom. But back to morning sickness and some tricks for dealing with it. You should avoid an empty stomach at all times by eating small and frequent meals every 1 to 2 hours. You should avoid a full stomach. For instance, do not drink a lot when you eat, because that quickly fills up your stomach, and of course, avoid large meals. Eat dry food, high-protein snacks and the famous crackers in the morning before even getting up. Avoid strong-tasting spicy food and avoid strong-smelling food because that can send you to the toilet bowl in an instant. It may be different foods and different smells that you can't stand with every pregnancy. That was certainly the case with me. With my middle son, for instance, I could absolutely not stand the smell of fried beef, but chicken was perfectly okay. What I find fascinating and have no explanation for whatsoever is that that kid did not like beef for years after he was born. With my other pregnancies, smelling a hamburger was no reason to throw up. Another thing that may be irritating your already delicate stomach are iron supplements. If that is the case, stop them for a few weeks until the morning sickness time is over. Then you can always give ginger a try. Ginger has been shown to help with reducing nauseousness, but does not seem to stop vomiting if morning sickness is severe. Ginger is safe to use in pregnancy, but you should not use it if you're on blood thinners. Some women also swear by acupressure on the nail point. You can find that point between the two tendons in the middle of the inside of your wrist, about 2 finger breadths from where the hand starts. It is the same point that gets pushed on by the so-called C-bands that people buy for seasickness or motion sickness in general. There are no studies which prove that this type of acupressure actually works for morning sickness, but many women swear by it, and if it helps you too, so what? It certainly will not hurt you to try. Then there are also some medications that you can take. Some will need a prescription, but many do not. One that doesn't need a prescription is vitamin B6, alone or in combination with certain motion sickness pills. You can take vitamin B6 alone, but before combining it with other medications, whether they are available with or without prescription, you should ask your doctor. The exception of that rule is doxylamine, which in many countries, including both the US and Switzerland, has been approved in that combination for morning sickness. It is usually available under various brand names without prescription. It also helps you sleep because doxylamine makes you drowsy and sleepy. So not something that you might want to take before going to work, or certainly not when you will be driving a car. Those are a few tricks and tips worth trying for the common and normal type of morning sickness. Luckily, that normal type of morning sickness generally goes away after a few weeks anyways. But there is a much more nasty version of morning sickness that tortures up to 3 out of 100 women. One of the most famous women who suffered from it in recent years and has been talked about all over is Kate Middleton, the future Queen of Great Britain. This type of extremely severe morning sickness is called Hyperemesis gravidarum. Hyper means too much, emesis means throwing up, and gravidarum means pregnancy-related. Hyperemesis gravidarum means too much vomiting in pregnancy, and too much it is. Women who suffer from hyperemesis gravidarum just cannot stop vomiting to the point that they get dehydrated and begin to starve and lose a lot of weight. This is, of course, very dangerous for the moms and for the baby growing inside them. It can get so bad that about 1 in 3 women begin to think about killing themselves. Some lose more than 15% of their body weight. That is more than 20 pounds for a woman weighing 135 pounds, or 9 kilos for a woman weighing 60 kilos. Losing that much weight at a time a woman should be eating for 2 and gain weight, not lose weight, is a major problem. Women may be vomiting so hard that they even break ribs and pop blood vessels. The severe dehydration, drying out from not being able to keep down even liquids, causes all sorts of medical complications other than just starvation, from blood clots to liver failure. It is really amazing that some women are willing to go through something like this more than once. Not just the normal form of morning sickness tends to happen again in the next pregnancy. The same is the case for the 3 out of 100 women with hyperemesis gravidarum. Some women are not given a choice whether they want to go through this again. No wonder they consider killing themselves. This is a very serious and at times life-threatening problem. It is not something that is just in a woman's head or a sign that she doesn't really want that baby, or other such stupid things that are sometimes being said by stupid people. Most often, prescription medication taken by mouth don't work. because the women cannot keep them down long enough to have any effect. Then these women need to be brought to the hospital and given fluid and fed directly into their veins to save their lives and save their babies. Because if the vomiting gets so bad that the woman begins to starve, then the baby also stops growing and may be born with what is called IUGR, intrauterine growth retardation, and may be born prematurely. Then the babies are smaller than they should be and are born earlier than is good for them. Of course, the diagnosis of hyperemesis gravidarum can only be made after the doctor has made sure that it's not any of the many other medical problems that can cause severe nauseousness, vomiting, and weight loss. That can be any number of liver, stomach, or bowel problems, from infections to tumors to twisted or otherwise blocked bowels to rotten food and poisons. It can be kidney stones or gallstones or fibroid tumors dying off, or diabetes or major hormone problems. Even brain tumors can cause these symptoms. All this has to be checked first before making the diagnosis of hyperemesis gravidarum. As I keep saying, in medicine, you always have to first figure out exactly what is going on before you can treat the problem. Otherwise, you might end up making grave mistakes and cause a lot of harm. That generally goes for life overall as well, not just medicine. I guess that has to count as today's tip for the week. And this brings us to the end of this episode. I hope you liked it and it gave you a lot of information that is useful to you or your friends and other women you know, even if you're not pregnant yourself, or at least not right now. And if you have any further questions about today's topic or any other topic having to do with women's health, please don't hesitate to send them to me at questions@gynoinfo.net. Again, that's questions@gynoinfo.net. And if you like this episode, please give us a lot of likes and share it around. It would also be super nice if you would subscribe to Gyno Info. It helps Josh and me to keep this podcast going. Thank you. Until next time, thank you for listening. And remember that you and your health are super important and deserve your full attention. Don't ever put off contacting your doctor because you're scared or embarrassed when something feels wrong about your body. Doctors are here to help you and not to judge you. And also, regular well-woman visits are always a good idea that you should make time for. You deserve it, and you owe it to yourself, and you owe it to your body and your health. This podcast is part of Pride House Media, hosted by me, Dr. Burki, produced and edited by Josh Rosenzweig. Original music composed by Nell Balaban. If you enjoyed this episode, please subscribe wherever you listen to podcasts. And while you're there, leave us a rating and a review. It really helps others discover the show. Stay connected and join the conversation by following me on Instagram and Facebook at Gyno Info and on LinkedIn at Gyno Info Podcast. Remember, any questions that I answer or information that I give you on this podcast are to be understood as information only, not treatment of your medical problems. While I'm a very knowledgeable gynecologist, I'm not your gynecologist who has talked to you and examined you personally and is therefore actually able to treat you. So please consult your own healthcare professional with any medical questions or concerns.